Medical Dilemma.
Welcome back to Medical Dilemma. Before we resume our discussions for the second segment, we'd like to say thank you to our major sponsors, Makati Medical Center, St. Clair's Medical Center, and LifeQuest Training and Consultancy Corporation. Now, joining me for the second segment are my co-hosts, Attorney Sara Sugitan, Father Jerry Manlangit, and Dr. Tess Sanchez. Yes. Okay, going back to Dr. Pontejos, you were talking about the second risk connected to surgery.
Yes.
Yes, maybe we should start again from there.
Okay. All right. Apart from the thyroid, on the side you have parathyroids, the parathyroid gland, and there are 4 of them actually. So 2 on each side. So when you operate, you see to it that you preserve it, unless it is also involved in the disease. Okay. So you want to preserve it so that the patient will not have hypoparathyroidism or hypocalcemia. Okay. So what are the symptoms of hypocalcemia? Usually they have tetanus-like symptoms. So they have
Ako nangingisay pala.
yeah, tetanus-like symptoms. So the muscles get stiffened, okay, and then there could be difficulty of breathing, you know, and there's twitching. Okay, so when you do this, it's what's called the Vostek, twitching. So these are signs of hypocalcemia. And so normally what we do if we do a total, because there's the higher risk if you do total thyroidectomy, is after 6 hours of surgery we check on the calcium level of the patient.
Of course, before you operate, you tell the patients already that
The
these
risk,
are the
yes.
risks. And sometimes they cannot really be avoided, doctor.
Yes, there are
because of
times when they
the
cannot
size?
be avoided. Sometimes the parathyroid can be inside the thyroid gland.
Oh, yeah.
One.
So ibang anatomy,
Yes,
iba-iba for
sometimes
each
ibang
person.
anatomy. And the other thing is, sometimes it is also involved. So you have to remove it.
Cancer or what?
Yes, if it's cancer.
But supposing there's cancer of the thyroid at hindi pa involved, do you remove
yeah,
it?
yeah.
You still have to remove.
Sineseparate naman.
Separate naman.
Sineseparate.
And can you survive with just one? You told us
Yes,
earlier, 4.
yes. There are 4. As long as you have one, you would still initially you would have symptoms, but later on you'd be able to adopt, and that if it survives the other parathyroid, you'll be okay.
Okay.
What happens to the human body if you remove, the entire thyroid?
Do we really,
Okay,
we really
they
need
become
it, right?
hypothyroid. So that means, so hypothyroidism, so that
So,
means,
pwede ring
so that means, yung sinabing matamlay ka,
Tamlay.
you have a tendency to grow fat, and, your skin turgors, your skin is dry, and all those things. So what you do, in fact, after thyroid surgery, when you have done a total, you give them supplements, thyroid hormone supplements. That will be maintained for life.
For life.
For life.
That's why you have to discuss this with your patient. You have to discuss with your patient. Yes, it's also life-changing.
How expensive is
No,
maintenance?
the thyroid hormones are not that expensive.
Not that
So
expensive.
they're okay. Maybe the 3 pesos or 5 pesos, depends. If you have a generic, maybe it's even cheaper.
That's per day.
Yes, per day.
Did you talk about the medical side? I mean, supposing the patient opted not to have a surgery, is
Okay.
there a choice?
Yeah, no, if it's malignant,
You
as
have
I was
to remove,
mentioning,
definitely.
there are some groups now who says if it's small, then you might just observe it. Just observe it. And
Kasi
then go,
hindi
patient
progressive,
go
hindi
on a regular
masyadong-
basis as long as it does not progress significantly, then you don't have to operate. But when it grows by 1/2 the size of the original, that's when you go in and you operate.
So,
Okay.
since you can afford to wait, that means it's not so aggressive.
Yes, that's why I was mentioning earlier on. If it's papillary or follicular, you can wait. It's not something like, oh, I have to operate on you. If not, you die. It's not that way.
You
Of
can
course,
wait
it's
for...
different if it's in a plastic. It's in a plastic, then survivors are very small. But if we can still operate on them, we operate on them immediately.
I see. How will you know if it is this kind of tumor or the other? Do you do a biopsy, needle
Yeah,
biopsy
you
or
do a
something?
fine needle biopsy.
Okay.
You do a fine needle biopsy, and okay, we have to qualify. Fine needle aspiration biopsy is very dependent on good cytologists. I always tell that because not all pathologists are cytologists.
Right.
So you have to have a good cytologist. Like at Manila Doctors, I have a very good one. That's why I can rely on it very well.
What's
Did I
the
mention the name? No. Okay, but she's a very good cytologist, so I really rely very heavily on my fine needle biopsy. But if, for example, the surgeon is in the province, not to demean or anything, but not too many cytologists are in the provinces. So sometimes you have to weigh things out. You know, sometimes they end up doing the operation, even without an FNAM. Even without a fine needle biopsy, because you cannot rely on their cytologist. Or they might not even have a cytologist in those areas. So I always tell that every time I give my lecture. I'm very lucky and blessed. In my hospital, I have very good cytologists, and I can rely on its results. On her results.
There are cases, doctor, in which, well, in spite of the information that you tell the patients, the risks and the dangers and benefits that might come, and sometimes accidents happen.
Yes.
There is where sometimes the problem would come
Yes.
afterwards, and of course patients will be wary.
Yes.
Why you were not so well, why you did not do your work, etc., etc. How do we inform patients like that when these things happen?
First,
It's quite difficult.
Yeah, first you have to inform your patients about this. I always tell my patients about the risk. Okay, even if I've done a lot of these cases, there's always a risk. So the risk of the recurrent laryngeal nerve being cut.
Right.
Okay, and so what happens is if it's 1, then you have hoarseness. If it's 2, you have good voice, but you'll have difficulty of breathing.
Oh.
Okay, because what happens is when you cut both, the tendency of the vocal cord is to go midline. So the patient could get choked. See, so you have to be very aware of that. And of course the parathyroid. The parathyroid. So normally we link up with our endocrinologist, so to help us out in terms of managing the hypocalcemia. Hypocalcemia is a relatively high complication with the total, particularly for malignancy, because sometimes it's very difficult, and sometimes it is involved, so you have to remove it. So there is a higher risk of complication with total
Of course.
total thyroid compared to just doing one side.
Because the nerve is just a nerve, right?
Yes.
It
Yeah,
can
the
be
nerve
even enveloped.
And the nerve at one point, when it's about to enter into the thyroid cartilage, it's very, very close to the thyroid gland. We call it the ligament of Berry, where it's very close. See? So that's why sometimes the surgeons also to play it safe will not remove everything. It's not strictly total.
Kaso kung cancer yan.
Yeah, that's the point.
Delikado,
If it's
you know?
cancer,
Yes,
then
yes.
you have to remove everything.
So I think it's a
that is
complication.
a dilemma. Yeah.
It cannot really be avoided at times, right?
Yes, but of course, complication rate is not as high. I mean, if it's done by good surgeons, it can go as low as 10%. Meaning, if you do 10, you might get 1 with a complication.
As far as your
And just hope you're not that one.
as far as your knowledge is concerned, doctor, well, have there been cases in which doctors have been
Complained of. no?
met lawsuits about this?
I'm not aware. I'm not aware, but I think it's really how you discuss it with your patient.
Yes, informed consent.
Yeah, informed
right?
consent.
They know that what to expect.
As long as they know that there's this risk, and the surgery is needed. I mean, it's something that you have to do. If not, something could happen to you later on. So that's why the important thing is for the doctor to discuss this very well with the patient before the operation.
I think that's a very good protection. By the way, short of cancer, we have the more common hyperthyroidism or hypothyroidism.
Yes.
Is it compatible with life, or what do you do
Oh
with
yes,
these people?
it is compatible with life as long as they're treated. Particularly the hyperthyroid patients, like they're running for 24 hours.
Very
Their
active.
pulse rate goes as high as 100,
And but that can lead to
120.
what? Heart failure,
Yes,
maybe?
they
or
could lead to heart. Well, but of
Oh,
course,
hyperactive,
as a surgeons, we don't normally treat them. We don't normally refer them to the endocrinologist, and they're the ones who give anti-thyroid hormones. So they
Okay,
give
to lower
anti-thyroid medicines
metabolism.
rather, so to
like-
bring down the metabolism.
The one who our guest for diabetes before, Dr. May Season, handles
Yeah,
things
they
like
hand-
that.
yeah, she handles that.
So, what else? Kung hypo naman, what will
Kung hypo,
happen?
normally you add on thyroid hormone. So
If you leave it as is, what happens?
oh yeah, if you leave it as
Always
is,
tamad-tamad.
yeah, they're kind of lazy.
So you lose jobs.
dull,
You think you're not
yeah,
working well.
yeah, and they tend to be fat.
But
And again, there's long term. There could be also a risk.
There
High
will still be
cholesterol,
risk.
etc., etc.
If you leave it
Yes.
untreated, there will
Yes.
still be
Yeah.
risk.
Those two diseases will have to be treated.
Ah,
The only thing is identifying them as such.
okay, so it's
Okay.
necessary. It's not an option.
Yeah, yeah. Because in the long term, of course, you're not talking about months, talking about years. Later on, they'll have problems.
The effect, long
Really heart
term.
problem, yeah. And maybe the hypothyroid later on will have a lot more cholesterol in their body, and so they'll have problems too with their heart.
So importante rin, the thyroid. Yeah.
Yes.
Yeah.
So those
So-
that have hyperthyroidism, they die of other complications. like
Yes, yes.
heart disease.
Yes, usually
But
they get enlarged heart.
Secondary to the
hearts.
Yeah,
hyper,
secondary,
to the
yeah.
hyperthyroidism.
That's right. That's right.
Yes. You just imagine you running for the next 24
24
hours.
hours.
And then one
Yeah,
week,
I
and then a month,
Hyper,
your pulse
hyper.
rate is 120.
So
all
you
the time.
overtax your heart.
Yes, yes.
Yeah,
okay.
it taxes your heart. Yeah.
Yeah.
How about aesthetically, doctor? Do you operate on, say, those who have, as
I-
you ordered, Adam's apple, kung medyo prominent yan?
Yeah, especially the
Hyper,
transgenders.
okay.
I want
I've done
to
a few of
remove that.
those females, very nice, very lovely females, and then they have a prominent Adam's apple. Adam's apple is a protrusion of the thyroid cartilage, which is the
The
bed,
cartilage.
which is the bed of the thyroid. So what we do is we just cut here anteriorly, so they look more ladylike rather than
Oo, sayang naman.
masculine.
The
yeah.
beauty. Oo, yeah. So everybody, in a way, both men and female, have Adam's apple? Or you call it only
We have
such
we
for the
call
male?
we call it Adam's apple when it's protruding, when it's prominent. yeah.
I see.
But yeah,
We're all born with that.
With
the
that
thyroid
cartilage.
cartilage,
I
yes,
see.
Okay, so
but for men it's more prominent.
okay,
Yeah, it's
we'll
more
have to
prominent.
take a pause again
Okay.
for a commercial break. Okay, don't leave this channel. We'll be right back after a few words from our sponsors.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
When you share something to a public, you find that experience, and that experience so rich it could change other people.